Helping loved ones who struggle with addiction. As a loved one of someone who struggles with addiction, you might feel helpless and confused about how to help. You want your loved ones to get better and find lasting recovery, but you don't know exactly what they need or how to support them on the road to healthy living. If someone you care about has addiction problems, it's important for you to understand what their struggles really involve and why they're having a hard time getting better. You also need to know how your actions affect them and why it's best to avoid some common mistakes that well-intentioned people often make. What is addiction? Addiction is a complex condition that involves physical, psychological, and emotional factors. It's not just about poor self-control or lack of willpower. It involves changes in the brain and body that make it hard for people to control their use of alcohol or other drugs even when they want to stop. Many factors can influence whether someone develops an addiction, including genetic and hereditary factors. Some people may be more vulnerable to developing risky substance use behaviors because of the brain changes that happen when anyone abuses drugs or alcohol. What causes addiction? It's a question scientists and doctors don't yet completely understand. Their research suggests that addiction might develop because taking addictive substances like alcohol or other drugs causes changes in how the brain functions. These can alter certain brain chemicals involved in things like mood, sleep, appetite, emotions, judgment, decision-making, impulse control, and metabolism. How families are affected by addiction. Addiction changes the life course of entire families, not only through the ways it hijacks a person's brain but also because of its effects on emotions, behaviors, relationships, and health. In addition to putting a strain on marriages and other types of relationships, substance use disorder can affect parenting skills, create financial problems, or leave people without homes. If you're dealing with a loved one who struggles with addiction, it's important for you to understand why these effects occur so that you can find ways to address them. How do I know if my loved one is struggling with addiction? Even though there are many different addictions out there, people struggling with addiction often face common problems. For instance, they may have an increased tolerance for drugs or alcohol, meaning they feel the need to keep using more of it in order to achieve intoxication or the desired effect. They may spend a lot of time thinking about the next opportunity to use substances, trying to find them, and then recovering from the drugs' effects. They might start to prioritize their life around getting drugs or alcohol instead of family and friends, work, school, hobbies, etc. They might try quitting on their own but fail to do both to withdrawal symptoms and cravings. They may also have given up on other methods of treatment programs because nothing has worked so far. They may show poor judgment by continuing to use drugs or alcohol despite having a history of negative consequences related to his or her use. How to help a loved one with an addiction. One of the most challenging things about having a loved one who struggles with addiction is knowing whether or not to confront them. You might be afraid that if you bring up your feelings, they'll get defensive or angry because it seems like you're blaming them for their actions. Even if you're not sure how to bring up your concerns with your loved one, or if they've already agreed to get substance abuse treatment, there are steps that you can take to support them on their journey towards recovery. Avoid enabling your loved one. So often, loved ones try to minimize the effects of addiction by making excuses for their actions or covering up evidence of substance abuse. While you might think you're doing your loved one a favor, this is exactly what an individual with substance use disorder wants: to keep on using drugs or alcohol without facing any consequences. Find ways to invest in yourself and spend time with friends and family. It's especially important for you to take care of yourself whenever your feelings are triggered or even when they're not. Stay informed about addiction by reading reputable resources, such as the National Institute on Drug Abuse or Alcoholics Anonymous. You can also attend online support groups that are hosted by these organizations to get additional support from people in your community who have been through similar experiences. Understand the triggers and cravings that might cause your loved one to use drugs or alcohol. Often, the stress of everyday life is so overwhelming for an individual with substance use disorder that they need a way to escape from it. It can be helpful if you anticipate these moments and create plans for how you're going to handle them together. Encourage your loved ones to talk about their feelings instead of numbing them with substances. Sometimes, individuals with substance use disorder who have grown up in dysfunctional homes are never taught how to regulate their emotions, so they meet problems with alcohol or drugs. What are the common mistakes to avoid when helping a loved one with an addiction? One common mistake is to treat addiction as if it were a choice. Remember that addiction isn't the same thing as having poor judgment or lacking willpower. It's a chronic disease just like heart disease or diabetes. One of the most harmful things you can do is to blame your loved one for their drug or alcohol abuse because someone with an addiction is already beating themselves up about it. Another mistake that loved ones often make is trying to minimize the problem. Remember that substance abusers aren't in control of themselves, so they really need the help and support of others. That means that you need to help your loved one seek treatment, not just sweep the problem under the rug until it blows up in your face later on. It's understandable that you might feel frustrated with your loved one for their drug or alcohol abuse, but try to remember that they're suffering too. Try to avoid taking out your anger or frustration on your loved one, since that will only make them feel worse about themselves. The road to long-term recovery is going to be tough, but by taking the right steps to support your loved one's sobriety, you can make a huge difference. What are the appropriate treatment options for addiction? The standard treatment for overcoming addiction involves attending therapy, such as individual or group counseling. Medication may also be part of the recovery process, and some people choose to attend treatment facilities such as inpatient rehab programs where they can take care of physical and emotional needs while learning how to live without substance use. There are many options for addiction treatment, including talk therapy, individual or group, family counseling, 12-step programs, medication management, and others. The two most common methods of treatment are psychotherapy, also called talk therapy, and medications. Without professional help, recovering individuals with substance use disorder may relapse back into drug abuse time and time again. It is vital that individuals with substance use disorder get the help they need by putting them into addiction rehab centers. Here, medical professionals can diagnose and treat their condition. Withdrawal can be very dangerous for someone who is not under professional supervision. Addiction treatment process. Evaluation. The first step is to get a full assessment of the person's current state. Medical, psychological and social factors are considered in order to create a customized addiction treatment plan for each individual. Screening. Substance abuse is often accompanied by other mental health issues, such as depression or anxiety. A comprehensive evaluation will include a screening designed to determine the presence of these co-occurring disorders. Detox. Medically supervised detox is the first phase of addiction treatment, during which withdrawal symptoms are managed by medication and other therapies. Treatment professionals help prevent potentially dangerous complications that might arise during this time. Therapy. Individual or group therapy can be helpful for teaching individuals with substance use disorder new coping strategies they can use to avoid relapse. Family therapy can also help a family member of individuals with substance use disorder understand what their loved one is going through and how they can best support him or her on the road to recovery. Medication. Medications exist to help manage cravings, ease withdrawal symptoms and block the effects of drug abuse, such as high blood pressure and increased heart rate. Different medications work in different ways, and a person may need to try out a few before finding one that works well. Community. Individuals with substance use disorder can attend social support groups for people who share their struggles or join community activities such as 12-step meetings or educational classes. These experiences provide an opportunity to establish new friendships with individuals who understand the challenges of addiction treatment and recovery. Relapse prevention. Once drug or alcohol addiction treatment is complete, individuals with substance use disorder may be taught how to manage stress or stressful situations and warning signs that trigger cravings in order to avoid relapsing back into drug abuse.